Still sick after Lyme treatment? Post-treatment Lyme disease syndrome explained. You had Lyme disease. You took the antibiotics. So why do you still feel terrible? For a meaningful group of patients, symptoms like crushing fatigue, aching joints and muscles, and foggy thinking drag on for months after treatment ends. This has a name, post-treatment Lyme disease syndrome, PTLDS. And if you are living with it, you are not imagining it and you are not alone. What PTLDS is. PTLDS describes symptoms that persist for 6 months or longer after completing standard antibiotic treatment for documented Lyme disease. The most common complaints are fatigue that rest does not fix, widespread musculoskeletal pain and joint aches, cognitive difficulties, the classic brain fog, covered in depth in how Lyme affects the brain and nerves, sleep disturbance. How common it is depends on the study, with estimates ranging from a few % of treated patients to considerably higher in some series. Whatever the true number, these patients exist in every Lyme practice. Why it happens. Researchers are still working this out, and there is likely more than one answer. Leading explanations include lingering immune activation that outlasts the infection, residual tissue damage from the illness, and, in some cases, questions about persistent infection or an undiagnosed co-infection, since ticks often carry more than one organism. It is also worth revisiting the original diagnosis. Was it really Lyme alone? Was treatment started late, or is something else going on entirely? What a thorough re-evaluation looks like. The wrong response to lingering symptoms is a shrug. A careful workup should revisit your exposure history and treatment timeline, screen for co-infections such as babesiosis and bartonellosis, and rule out unrelated conditions that mimic PTLDS, including thyroid disorders, anemia, sleep apnea, and autoimmune disease. Remember that Lyme test results have real limitations and need interpreting in context. Visit the link in the description below for more information.